Did you know that 40% of Americans report their bowels disrupt their daily lives? Or that 3 out of 4 can't even poop in a public restroom? In just a few minutes, we're diving into these surprising truths and more, based on a revealing conversation with Harvard Dr. Trisha Paz-Richa on the Mel Robbins podcast.
Prepare to rethink everything you thought you knew about your gut.
Dr. Paz-Richa reveals that your gut is far more than just a digestive organ. It's truly a second brain, housing more nerve cells than your entire spinal cord. It produces neurotransmitters like dopamine and serotonin, constantly communicating with your head brain via the vagus nerve. This gut-brain connection means your gut influences everything from your immune system, which accounts for 70% of your body's defenses, to hormone production that impacts your mood and blood sugar. Even diseases like Parkinson's can originate here. But what about those gut feelings we often talk about?
They're not just metaphors. Stress, fear, and excitement trigger real physiological responses in your gut, often faster than your conscious brain can process. A gut feeling isn't inherently good or bad. It's a message that the stakes of the situation are higher than you realize.
Instead of acting impulsively, Dr. Paz-Richa advises pausing and asking, what am I missing about this situation? What is my gut perceiving that my brain hasn't yet understood? This approach helps you gather more information rather than making snap judgments. It's time to talk about the widespread gut health crisis. Beyond the 40% struggling daily, 15% of Americans have irritable bowel syndrome. 1 in 10 live with chronic, unexplained pain after eating. Even a quarter of college students spend over 10 minutes trying to have a bowel movement. Many people normalize these symptoms, believing they're just winging it or that everyone else has it under control. This lack of open conversation means we're missing crucial information about our own bodies. So, what exactly is normal when it comes to bowel movements?
A normal bowel movement should be effortless, without straining, and occur at a socially appropriate time. This means you shouldn't be panicking about going out or giving a presentation. Frequency can range from 3 times a day to once every 3 days.
Your poop is like a daily report card on your health. Pay attention to its shape, consistency, color, and how you feel during and after. This information can reveal a lot about your diet, inflammation, and how your gut's brain is functioning. Let's decode what your poop is telling you. Ideal poop looks like a smooth sausage or is slightly fluffier and softer. This indicates efficient expulsion and a well-functioning system. When it comes out in one long piece, it means your pelvic floor muscles worked in a coordinated dance.
If you're seeing hard, pellet-like poop, it's a sign that stool has been sitting in your colon too long. The colon's job is to suck water out, so holding it in makes it drier and harder. Don't ignore the urge to go, even at work.
Chronic constipation can often be a mechanical issue. The puborectalis muscle chokes off the rectum when we sit at a 90-degree angle on modern toilets. Raising your knees above your waist, using a stool, helps relax this muscle, opening the tube for easier passage. Now, let's talk about colors you might encounter and what they mean. Green poop can be normal if you've eaten a lot of chlorophyll-rich foods like greens powder. However, if it's accompanied by fever or diarrhea, it could signal a problem, as rapid transit often results in green stool. Maroon or bright red poop is a serious warning sign of bleeding. Maroon suggests bleeding from higher up in the colon, while bright red is typically from lower down, possibly hemorrhoids. Any new instance of this, especially with dizziness, requires immediate medical attention. Pale clay or white poop is an emergency. This color indicates a blockage of bilirubin, which normally gives poop its brown color. It could be a gallstone or something more serious, so contact your doctor immediately.
Jet black or tarry poop is also an emergency, often indicating upper GI bleeding where blood mixes with stomach acid. The exception is if you're taking iron pills, which can harmlessly turn your stool black.
Purple poo can be due to anthocyanins in foods like blueberries or red wine. If it's a one-off and you know the cause, it's usually fine. But if it's new, unexplained, or accompanied by other symptoms, consult your doctor.
The good news is that shades from caramel to dark chocolate are generally considered normal and healthy. Beyond colour, your toilet habits profoundly impact your gut health.
The 5-minute toilet rule is crucial. If nothing happens within 5 minutes, pull up your pants and come back later. Bringing your smartphone into the bathroom can increase your time spent by over 5 times and raises your risk of hemorrhoids by 46%. Hemorrhoids are engorged veins around your exit. Prolonged sitting on an unsupported toilet seat, especially while distracted, allows these veins to passively fill, leading to irritation and discomfort. Eating more fiber and using mild steroid creams or sitz baths can help.
When it comes to wiping, choose 2-ply toilet paper for its gentleness and efficiency. A gentle dabbing motion is best to prevent microscopic tears and irritation, especially for sensitive areas.
However, toilet paper isn't the ultimate solution. Dr. Pasricha advocates for bidets, which provide superior cleanliness. Studies show hands have more microbes after wiping with toilet paper than after using a bidet, emphasizing the effectiveness of water for hygiene.
Let's debunk some popular gut health myths.
The term leaky gut is often misused on social media. While increased intestinal permeability is a real scientific phenomenon, it's rarely the root cause of vague symptoms like brain fog or bloating. Self-treating based on social media can lead to misdiagnoses for treatable conditions like celiac disease. Another myth is that everyone needs probiotics. The American Gastroenterological Association doesn't recommend them for most conditions due to insufficient robust data. Instead, focus on prebiotics like fiber and fermented foods, which act as fertilizer for your existing gut microbes.
Dr. Pasricha shares her personal game changer for gut health. She stopped trying to get all her fiber from diet alone and now takes a daily psyllium supplement. This plant-based soluble fiber is a shapeshifter that helps with both diarrhea and constipation, supports gut bacteria, and can even lower cholesterol. It's a simple, effective shortcut to better gut health.
Remember, your gut is a brain, and treating it as your most precious organ is foundational to your entire health. The habits that support your gut, minimizing ultra-processed foods, reducing alcohol, and eating more fiber, also reduce your risk of dementia. Protect your gut, protect your future. We hope this deep dive has empowered you with knowledge to better understand and care for your gut. For the full, in-depth conversation with Dr. Trisha Pasricha, make sure to watch the complete video on the Mel Robbins channel. You'll find the link in the description below.
Enjoying quick summaries like this and saving time? There's more coming, so hit that subscribe button.